Hi, my name is Dr. Rachel Bushing. I'm the Director of Pop Psychology Inc., Ride the Rainbow in 2023, and also our perinatal service, Three Little Birds Perinatal Psychology. This video is intended to provide some information to non-mental health clinicians, so our referrers and community partners, whether that be GPs, midwives, paediatricians, birth support professionals, anybody who's working in and around parents during pregnancy or work in early childhood really. So the intention of this video is to give you a little bit of information about what sorts of things might crop up for parents at this stage of life, and also to give you some information about how you might look out for perinatal mental health distress and what it might look like to refer into a service such as ours. So first of all, just a little bit of information. What is really significant about this field is that if a parent, women and men, are going to experience a mental health issue at any point of time in their lives, this period of time, so the perinatal period between preconception, which is even just thinking about starting a family, through to conception, fertility concerns, pregnancy, birth, and up to 3 years postnatal is what we consider to be the perinatal umbrella. This is the period of time in life when we're most at risk of developing a mental health problem. But it's important to recognise that it goes beyond postnatal depression. Postnatal depression can be commonly an endpoint for people who might be struggling. Often the risk factors for developing postnatal depression are actually some of the preconditions that begin to bubble away in those earlier phases throughout their journey towards parenthood. And one of the reasons we're so passionate about early intervention in perinatal psychology is because it's a really foundational time for the establishment of the family and the well-being of the family as a whole. And there are so many things that can kind of impact upon families at this really sensitive time juncture. And when we look at what that impacts might be for the young people, so for the infants, for the babies, for the toddlers that are being caught up in a system of distress at this time of life, it's important to acknowledge that this is a really sensitive phase of life. So what it is that's going on, and if we can support things to go well in this phase, that's what we're all about basically. But we really need our partners and our community supports to help us with the process of identifying and referring our clients in, and hopefully at the time juncture where things are starting to first manifest, because we know the trajectories to postnatal depression are often when adversity is beginning in those early stages. In terms of statistics, about 1 in 5 mothers will experience anxiety or depression in antenatal or postnatal. And we know also that about 3 in 4 new mums are reluctant to seek help. So we're really keen to reduce those barriers to support, and community partners is one of those ways that we think it's important to do that. There can be many different issues that women might present with: grief and bereavement, infertility decision-making, relationship health between the partners. Postpartum psychosis and bipolar disorders are rare, but they can happen at an increased rate in this period, and all sorts of anxiety conditions, panic, social phobias, and obsessive compulsive type anxieties, we're starting to learn are really common in both pregnancy and postnatal. So why it's important to consider a perinatal specialist is because we're starting to understand that if we just treat our bog standard depression, anxiety conditions as we would any other type of condition, we're losing access to some of our clients, because a lot of people can't make use of the techniques and strategies that we would traditionally encourage a client to do, because they're needing to navigate through this developmental period, and they're needing to raise a baby in amongst all of this stuff when their emotional distress is getting on top of them. So one difference between a perinatal specialist like you find at our service is that we are trained to orient toward the well-being of the primary parent, often the mother, but dads are really important too in this system, and the well-being of the young person, the infant to come. So we try and do interventions that are straddling the needs of both of those, so the dyad, the parent and the baby at once. In terms of picking up women who might benefit from our service, The Edinburgh Postnatal Depression Scale is the most well-known, the most widely used screening measure. It's really easy to find. It's only 10 items, and you can find it, say, on the COPE website or Beyond Blue, lots of different places, just a Google search. We wanted to also let you know that some of the screeners, like the DAS21 or the K10, that's used a lot in general practice, they will also be helpful in detecting if somebody is exhibiting some distress in this period of time. And there are some psychosocial screeners as well, so the ANRQ, and if you want to find more information, the COPE website is a really good source of information for that. Another thing we think might be important is that there's some evidence for just asking a couple of screening questions. So if you've got a really brief moment with that mum, if there's a screaming baby in the room, all of that kind of thing, if you can just hold in mind that just asking, how have you been coping? And genuinely offering a listening ear to how that response is going. 2 key questions may be particularly helpful. So asking, number one, are you finding that you've lost interest or pleasure in the things that you normally would have done? And is that feeling of just not feeling like you can get any joy from anything, has that been, just a day-to-day fluctuation, or is it something that is bubbling away, longer standing, or getting worse? Second, just how are you feeling? Have you felt down, depressed, hopeless, numb? Has that been a feeling again that is persisting or is worsening? So that's it. Thank you so much for listening. We have a team of 11 perinatal specialists across 2 locations in Brisbane, and we would be more than happy to hear from you. We will attach some information to this resource when it goes out. Thanks so much. Bye.